Hello everyone and welcome back. In this video I will be talking about COVID-19 treatment updates. What's new and what do we know about the COVID-19 treatment as of May 2nd, 2020. There has been some exciting news in the media about the new molecules, and we will quickly look at what's the evidence and where do we stand. As of today, close to 3.5 million people has been affected across the globe with COVID-19, and the scientific community is really working hard. And if you see, there has been 686 registered trial across the globe as of May 2nd. So to look at how the treatment works, we need to understand three basic aspects of this infection. So number one, there is a virus. Two, it gets transmitted from one person to another person, which is called the host. And this transmission is the only way the virus can really survive, because it can survive only for a few hours in the environment, or up to probably a few days on some other surfaces, but it needs a live host. It needs another human being, otherwise this virus is gonna die. So the only way it can survive is transmit from one person to another, and the person who is having less immunity gets infected and it passes on to the virus to another person. So the way we treat a viral infection is either we kill the virus with antivirals, or we block the transmission, which is being advocated by health authorities, and the third is working on the vaccine so that the host immunity could be boosted up. And what we know now about this virus is most of the transmission is direct from one person to another, but it can also be indirect through the contaminated surfaces. The easiest way: block the transmission, have a safe distance, or stay at home. But if you really want to kill the virus, you have antiviral drugs, or if you want to boost the immunity, you have vaccines. So as far as the antivirals are concerned, we have three molecules which has been tested to some or greater extent as of today. So the first molecule everybody knows, chloroquine, hydroxychloroquine, which President Trump has widely publicized it, but unfortunately there's not much evidence to support its use. There's a very little evidence, and I will quickly talk about that too. Then second molecule is lopinavir-ritonavir, which has been HIV treatment medication and has been now tested in COVID-19. And third, and the most promising, is the remdesivir, which has been found to be useful. And obviously we can use the antibodies from the persons who have recovered from coronavirus and give it to the person who is sick, and thereby reduce the severity of the infection. That's called convalescent plasma, and has also been found to be useful, but again in the small studies. So now, talking about chloroquine, hydroxychloroquine, this is an anti-malaria drug. It's widely available, it's inexpensive, and it appears to be safe, because not only it has been tried in malaria, but also many other diseases like autoimmune diseases, and it's been found to be safe. But the question is, it's safe in those individuals, but is it really safe in COVID-19? Especially people who are having severe infection, because these people have damage to their many organs, and in that scenario we don't understand whether this same safe molecule is really safe or not. And there has been many studies which showed there are concerns about the cardiac side effects or the bad effects on the heart with this medication. Second, we don't know the efficacy. How effective is this drug in COVID-19? And there has been only 6 small studies, and the biggest study did not include even up to 100 patients. So you can understand there's a very limited data. And again, there were 2 French studies, very small studies, which has been widely publicized with the media. Unfortunately, these are not really good studies because these were non-randomized studies, and there's a lot of bias as far as the results are concerned. So we don't know whether chloroquine or hydroxychloroquine really works. What we do know is it might reduce the viral load. So that means the number of viruses which the person is shedding or coughing out might be lower, again with the limited evidence. The second drug is the HIV drug, lopinavir-ritonavir combination. Unfortunately, it was not found to be of much use in this trial, which was more robust trial, and there was no definite clinical improvement, and the mortality of that death rate was not any different compared to people who were managed without this medication. The third and the most promising is remdesivir. So this was tried in severe COVID-19 patients on compassionate basis, and more than 2/3 of the patient, they responded to the treatment. And now there has been new trial evidence which has not been published yet, which much bigger sample size, and it shows that this molecule works. So it's probably the most promising treatment which is available. As far as the vaccines are concerned, we don't have a vaccine yet, and we are hoping in next 6 months or so or earlier we might be able to get these vaccine approved, but we are still far from the vaccine. So the good news is we do have some options available, especially for patients who have severe infection. Please hit the like button if you like this video and found it useful. Please subscribe the channel to support the channel. Comment and share. Thanks for watching the video.